This story ends with a living baby. 6 losses came before her. But she never stopped hoping. Real story, told by a gynecologist. For support only, not medical advice. You are not alone. You are safe here. Let's begin. You know, when you sit in this chair long enough, you start to recognize something in a woman's eyes before she even says a word. It's not something I was taught in medical school. It's something you learn after years of holding hands in small examination rooms, after delivering news that changes lives, after watching hope flicker, and sometimes go out. Jennifer walked into my clinic on a Tuesday morning. The rain had finally stopped after 3 days, and the sun was cutting through those gray clouds in a way that made everything look sharper. But I wasn't looking outside. I was looking at her. She was 37 years old. She wore a simple blue sweater and had her hair pulled back. Her hands were folded in her lap, calm, but her knuckles were white. And her eyes, those eyes had seen something. Something heavy. I asked her the usual questions. When was her last period? Any medications? Any previous pregnancies? And that's when her voice changed. It didn't break. It just became quieter, like she was pulling each word from somewhere deep. She said, "I've had 6 miscarriages, doctor." 6. Let that sit with you for a moment. She told me the first one happened when she was 31. She and her husband Michael had been trying for a year. They were excited. They told their parents at Thanksgiving. And then at 10 weeks, the bleeding started. No heartbeat. Just silence in the ultrasound room. The second one came 8 months later. Then the third. By the 4th, she said she stopped buying baby things. By the 5th, she stopped telling anyone except Michael. By the 6th, she stopped believing it would ever be different. But here she was. In my office. For the 7th time. I looked at her file. 6 losses. No living children. And yet she was sitting there. She had driven 40 minutes in that Tuesday morning traffic. She had filled out the same paperwork she must have filled out half a dozen times before. She had walked through those doors again. I asked her what made her come back. She looked at me, and for the first time, I saw something shift in her expression. Not desperation. Not resignation. Something else. She said, "Because I still feel them, doctor. All 6 of them. I never got to hold them. But I feel them. And I think they're waiting for me to bring their brother home." I didn't know then that this woman would teach me more about patience than 20 years of medicine ever had. I didn't know that her 7th pregnancy would take us to places neither of us expected. But right then, sitting across from her, I made a quiet promise to myself. I would do everything in my power to help this woman become a mother. And so we began. I ordered a full panel of blood work for Jennifer that same afternoon. When a woman has lost 6 pregnancies, you don't wait. You don't say, "Let's try again and see what happens." No. You dig. You look for answers in places most people don't even know exist inside their own bodies. The test took 3 days to come back. 3 days where I found myself thinking about her more than I should. That blue sweater. Those white knuckles. That quiet voice saying, "I still feel them." When the results arrived on my desk Friday morning, I sat with them for a long time before I picked up the phone. Jennifer had something called antiphospholipid syndrome. It's a mouthful, I know. But here's what it means in simple terms. Her immune system was attacking the very thing she wanted most. Her blood was clotting too easily, forming tiny clots in the placenta, cutting off oxygen and nutrients to each baby before they could grow strong enough to survive. 6 times this had happened. 6 times, her body had turned against itself without her ever knowing. I called her and asked her to come in the next day. She didn't ask why. I think she had learned not to ask. She just said, "What time?" When she sat across from me again, I explained everything. I used the small diagrams I keep in my drawer, the ones I pull out when words aren't enough. I showed her how the placenta works, how blood flows from mother to baby, how those tiny vessels can get blocked. Jennifer listened without interrupting. Her hands were in her lap again. White knuckles again. When I finished, she asked me one question. Just one. She said, "So my body killed them?" And there it was. The question every woman in her position eventually asks. The one that breaks my heart every single time. I reached across the desk and took her hand. I told her no. Her body didn't kill anyone. Her body had a condition she couldn't control, couldn't prevent, couldn't even know about without the right tests. This wasn't her fault. None of it was her fault. She pulled her hand back and wiped her eyes with the back of her sleeve. Then she asked the second question. Can you fix it? I told her there was a treatment. Daily blood thinner injections. Close monitoring. Medication that would help prevent those tiny clots from forming. But I also told her the truth. There were no guarantees. Even with treatment, some women still miscarried. Some babies still didn't make it. Jennifer nodded. She looked down at her hands. Then she looked up at me. And I saw that same shift in her eyes from Tuesday morning. She said, I've lost 6 babies, doctor. I'm not afraid of a needle. I wanted to tell her that she should be afraid. That hope was dangerous. That I had seen this story end badly before. But I didn't. Because something about Jennifer made me believe that maybe, just maybe, the 7th time could be different. She left my office with a prescription and a calendar marked with injection dates. She didn't know then how hard those injections would be. Neither did I. Jennifer came back 2 weeks later for confirmation of pregnancy. And there it was on the ultrasound screen, a tiny flicker. A heartbeat. So small but so steady. I measured it carefully, counted the beats per minute. Watched for any sign of trouble. Everything looked exactly as it should. But I've learned not to celebrate too early. Not with women like Jennifer. She started the blood thinner injections that same week. Her husband Michael learned to do them because Jennifer couldn't bring herself to push the needle into her own skin. Every evening at 7 o'clock he would draw up the medication, find a spot on her belly, and inject her. She told me later that some nights she cried. Some nights she didn't feel anything at all. And some nights she held her breath and prayed while the medicine went in. The first milestone came at 6 weeks. With her previous pregnancies, she had always started bleeding right around then. But this time nothing. No spotting. No cramping. Just quiet. She called my office on a Wednesday morning, her voice shaking. She said, I'm still pregnant, right? I feel pregnant. My breasts hurt. I'm exhausted. But I keep waiting for the bleeding to start. I told her to come in for an early ultrasound. The waiting room was full that day. Pregnant women with rounded bellies, flipping through magazines, laughing with their partners. Jennifer sat apart from them in the corner, her coat still on even though it was warm inside. She didn't look at the other women. She looked at the floor. When I called her back, she walked so slowly, like she was walking towards something she both wanted and feared. The ultrasound room is small. Dim Lili. There's a chair for the partner, but Jennifer came alone that day. Michael was at work, and she hadn't wanted him to take more time off. Not again. She lay on the table, and I applied the gel. Cold, I warned her. She didn't flinch. I moved the probe over her lower belly, searching. The room was completely silent except for the soft hum of the machine. And then I found it. The gestational sac. The yolk sac. And the embryo, measuring exactly 6 weeks and 2 days. And the heartbeat. Still there. Still strong. I turned the screen so Jennifer could see. I pointed to the flicker. I said, That's your baby, Jennifer. She didn't speak for a long time. She just stared at the screen, at that tiny pulsing light. Then she covered her mouth with both hands, and her shoulders began to shake. I thought she was crying from happiness. But when she lowered her hands, her face was raw with something else. She looked at me and said, I've never made it to 6 weeks before. I've never seen a heartbeat this early. What if I lose it tomorrow? What if this is the last time I see it? I didn't have an answer for her. No doctor can promise tomorrow. But I told her what I knew to be true in that moment. Her baby was alive. Right now, in this moment, her baby was alive. And that was worth holding on to. She nodded, wiped her face, and pulled her coat tighter around herself. The next milestone came at 8 weeks. Then 10. Each ultrasound felt like climbing a mountain, reaching a ledge, and realizing there was still so much higher to go. Jennifer started to relax just a little. She started to say when the baby comes, instead of if. But then at 14 weeks, everything changed. The call came at 7:15 on a Monday evening. I was at home, going through patient files at my kitchen table, when my pager went off. It was the after-hours nurse. Jennifer was on the line, bleeding, bright red blood, enough to soak through a pad in less than an hour. I told the nurse to have Jennifer come to the hospital immediately. Not the clinic. The hospital. I would meet her there. The drive took me 18 minutes. It felt like an hour. I kept going over the possibilities in my head. Subchorionic hematoma, placental abruption, or the worst one, miscarriage. With Jennifer's history, with her blood clotting disorder, with everything she had already lost, my mind went to the darkest place first. It always does. That's what experience teaches you. Hope is beautiful, but it doesn't prepare you for the other side. When I got to the maternity unit, Jennifer was already in a gown, lying on a bed that looked too big for her. Michael stood by the window, his arms crossed, his face pale. No one was talking. The only sound was the rhythmic beep of the fetal monitor they had strapped across Jennifer's belly. I washed my hands quickly and walked to her bedside. She grabbed my wrist before I could say anything. Her fingers were cold. She said, "I felt it happen. I was making dinner. And then I felt this release. I ran to the bathroom, and there was blood everywhere. Everywhere, doctor. I knew. I just knew this was it. This was how it ends again." I didn't reassure her. Not yet. Because I hadn't seen the ultrasound. I hadn't confirmed anything. False reassurance is cruelty dressed up as kindness, and I refused to do that to my patients. Instead, I asked the nurse to bring the portable ultrasound machine. While we waited, I held Jennifer's hand. Michael came and stood on her other side. The three of us sat in that small hospital room, listening to the monitor beep, waiting for answers that could destroy everything. The machine arrived. I positioned it, applied the gel, and began the scan. Jennifer held her breath. Michael stared at the screen. The room became so quiet that I could hear my own heartbeat in my ears. I found the placenta first. Intact. Good. Then the amniotic fluid. Levels looked normal. Then I searched for the source of the bleeding, and there it was. A dark crescent shape between the placenta and the uterine wall. A subchorionic hematoma. A pocket of blood that had formed and was now making its way out. This was serious. Hematomas can lead to placental abruption. They can cause preterm labor. They can end pregnancies. But they don't always. I needed to find the baby. I needed to see if the heartbeat was still there. Jennifer must have seen something shift in my expression because she squeezed my hand harder and whispered, "Just tell me. Whatever it is, just tell me." I moved the probe, adjusted the angle, and then I saw it. The baby, floating peacefully in the gestational sac. Limbs moving, heart beating, strong, steady, defiant. I turned the screen toward Jennifer and pointed. "There," I said. "There's your baby. Heart rate is 158. Perfect for 14 weeks. The sound that came out of Jennifer's mouth wasn't a cry or a laugh. It was something in between. A release. A sound of air leaving her body after being held for too long. Michael put his hand over his mouth and turned away for a moment, and I saw his shoulders shake. But Jennifer wasn't done looking at the screen. She watched her baby move those tiny arms and legs, completely unaware that his mother had just lived through her worst fear all over again. He was in there, swimming around like nothing had happened. Like the world hadn't almost ended. I explained the subchorionic hematoma. I told her that many women have them and go on to have healthy babies. But I also told her the truth. She needed bed rest. Complete pelvic rest. No lifting, no straining, no stress if she could avoid it. The hematoma would either resolve on its own or it wouldn't. And there was nothing any of us could do to control which path it took. Jennifer looked at me with red-rimmed eyes. She said, "So I just lie there and wait? Again? I've been waiting for 4 years, doctor. I've been waiting through 6 losses. I've been waiting for a baby that might never come home. And now you're telling me to wait more?" Her voice cracked on the last word. And I understood. I truly did. Because patience isn't just waiting. Patience is waiting when you have every reason to believe that waiting will break you. Patience is staying still when everything inside you wants to run, to fight, to do something. I sat on the edge of her bed. I don't usually do that. There's an unspoken boundary between doctors and patients. A professional distance that's supposed to protect both of us. But Jennifer had crossed that boundary the moment she walked into my clinic with those white-knuckled hands. She wasn't just a patient anymore. She was a woman I was fighting for. I told her something I rarely say out loud. I told her, "This baby wants to stay. I've been doing this for 20 years, and I can feel it. He's not ready to leave you. So you lie there and you let your body do its job, and you let me worry about everything else." Jennifer stared at me for a long moment. Then she nodded. She reached for Michael's hand and pulled him closer. The three of us sat in that hospital room while the monitor beeped, and the baby's heart kept beating. She was discharged the next morning with strict instructions and a follow-up appointment in 2 weeks. But as she walked out of the hospital, she was walking differently. Slower. More careful. Like she was carrying something precious and fragile. Because she was. The bed rest continued for weeks. The injections continued. The fear continued. But something else continued too. That heartbeat. Week after week, appointment after appointment. That stubborn, unbelievable heartbeat. And then at 24 weeks, something new appeared on the ultrasound. Something that made my stomach drop in a way I hadn't expected. The bed rest had been hard on Jennifer. I knew it would be. But I don't think any of us anticipated just how deeply it would affect her spirit. Around week 18, Michael started calling me more often. Not with medical questions. With worried husband questions. He said Jennifer had stopped talking. Stopped singing along to the radio like she used to. Stopped responding to text messages from her sisters. She would lie on the couch for hours, staring at the ceiling, one hand resting on her growing belly, but her eyes completely empty. At first, I thought it was normal. Bed rest is isolating. The mind doesn't like being trapped in a body that's supposed to be resting. But by week 20, Michael's voice on the phone sounded desperate. He said, "She hasn't smiled in 12 days. 12 days, doctor. She eats because I put food in front of her. She takes her injections because I give them to her. But she's not there anymore. It's like she's already left." I made a house call that same evening. I don't do house calls. My practice is too busy, and frankly, I'm too old to be driving across town with my medical bag like some doctor from a different century. But for Jennifer, I went. Her house was small but neat. A brick home with a porch swing and flowers that had recently been planted, but were now wilting from neglect. Michael let me in, and I found Jennifer on the couch, just as he had described. She was wearing the same blue sweater from our first appointment. Her hair was unwashed. Her eyes were fixed on a spot on the ceiling. I sat down on the coffee table in front of her, so she couldn't avoid looking at me. I said her name. No response. I said it again. Nothing. Then I did something I'm not proud of. I reached out and took her hand, and I squeezed it hard enough to get her attention. She blinked. Looked at me, and for a moment, I saw recognition in her eyes. Then it faded, replaced by something flat and hollow. She said, "Why are you here, doctor? There's nothing you can do. The baby is still in there. I can feel him kicking. But I can't. I can't feel anything else. I'm so tired. I'm so tired of being brave. I'm so tired of hoping and then having that hope ripped away. I don't want to hope anymore. It hurts too much." I didn't give her a speech about staying positive. I didn't tell her that everything would be okay, because I didn't know if it would be. And lying to a woman who had lost 6 babies would have been the cruelest thing I could do. Instead, I told her the truth. I said, "You don't have to be brave right now. You don't have to hope. You just have to stay alive. 1 hour at a time. 1 breath at a time. And if you can't do it for yourself, do it for Michael. Do it for that baby who keeps kicking, even when you can't feel anything else." Jennifer started to cry. Not the quiet tears from our earlier appointments. These were loud, ugly sobs that came from somewhere deep and broken. She cried for the baby she had lost. She cried for the daughter she would never hold. She cried because she was terrified that this baby would be taken from her too. I held her while she cried. Michael knelt on the floor beside us and rested his head on her knee. The three of us stayed like that for a long time, in the fading evening light, with the sound of Jennifer's grief filling every corner of that small living room. When she finally stopped, she looked at me with swollen eyes and said something I will never forget. She said, "I don't know how to be a mother if I'm too scared to love him." That sentence stayed with me. It followed me home that night. It sat in the passenger seat of my car. It stood in the corner of my bedroom while I tried to sleep, because Jennifer had put into words something I had seen in so many women before her. The way loss can freeze the heart, can make a woman hold back her love as if protecting herself from future pain. But here's the thing about pregnancy. The baby doesn't wait for you to be ready. The baby grows whether you're smiling or crying, whether you're planning a nursery or staring at a ceiling. And at 24 weeks, Jennifer's baby was growing. But not enough. The growth scan was scheduled for a Thursday morning. Jennifer came to the hospital this time, not the clinic, because I wanted access to the more advanced ultrasound equipment. Michael took the day off work. He held Jennifer's hand as she walked through the corridors, her belly now clearly rounded beneath a loose floral dress. She had gained weight. Her hair was clean. She was talking again, making small observations about the hospital artwork, the squeaky wheel on the ultrasound cart. Small improvements. But I could still see the shadow behind her eyes. The fear that was always there, waiting. I performed the scan myself. I measured the baby's head circumference, the abdominal circumference, the femur length. I watched the numbers appear on the screen, and I felt my heart sink with each measurement. The baby was measuring in the 7th percentile. Small. Too small. I measured again. Same result. Jennifer noticed my silence. She knew my patterns by then. When I was quiet during a scan, it meant I was seeing something I didn't want to say out loud. "Doctor," she said. "What is it?" I turned the screen so she could see the growth charts. I pointed to the curve that represented a normal pregnancy. Then I pointed to where her baby's measurements fell. Far below the curve. Far below where he should have been at 24 weeks. I told her the diagnosis. Intrauterine growth restriction. The placenta wasn't delivering enough oxygen and nutrients. The baby was struggling to grow. And with Jennifer's blood clotting disorder, this was a known risk. The very condition we had been treating with those daily injections, it was still affecting the placenta, just more slowly than before. Jennifer stared at the screen. Her baby was moving, punching those tiny fists, completely unaware of the numbers that surrounded him. She asked me the question I had been dreading. Are we going to lose him too? I couldn't say no. I couldn't promise her that everything would be fine, because growth restriction at 24 weeks is serious. It can lead to stillbirth. It can lead to emergency delivery before the baby's lungs are developed enough to breathe on his own. But I could tell her the plan. I told her she would need even closer monitoring now. Twice weekly ultrasounds to check the baby's growth and movement. Weekly non-stress tests to monitor his heart rate. And if his condition worsened, we would deliver early. Very early. Jennifer listened without interrupting. When I finished, she turned to Michael. They had one of those silent conversations that married people have, where everything passes between them in a single glance. Then Jennifer looked back at me and said, "How early are we talking?" I took a breath. If we're lucky, we can keep him inside until 32 weeks. Maybe 34. But if the placenta fails faster than that, we deliver whenever we have to, even if it's now. The room went very quiet. The ultrasound machine hummed. The baby kicked, and we all saw his little foot press against the inside of Jennifer's belly. She put her hand over that spot and held it there. The next 2 weeks were a blur of hospital visits, monitoring strips, and waiting. So much waiting. Jennifer came in every Monday and Thursday for non-stress tests. We would strap the monitors around her belly and listen to that baby's heart rate for 20 minutes, sometimes 40, watching for signs that he was getting tired, getting stressed, getting ready to give up. Some days the tracing was perfect. Accelerations when he moved. A beautiful, reactive pattern that made me exhale with relief. Other days the line was flat. No accelerations. No response. Those were the days when Jennifer would grip the sides of the hospital bed and stare at me with those eyes, asking without asking if this was the beginning of the end. At 26 weeks, the baby's growth had dropped to the 5th percentile. His movements were becoming less vigorous. The amniotic fluid level was decreasing. Every sign pointed to the same conclusion. The placenta was failing. I sat down with Jennifer and Michael in a small consult room. No windows. Fluorescent lights that hummed. The kind of room where difficult decisions are made. I told them it was time to admit Jennifer to the hospital for continuous monitoring. No more going home between appointments. No more waiting for something to go wrong. From now on, she would be on the maternity unit, connected to those monitors around the clock, ready for delivery at the first sign of trouble. Jennifer nodded. She didn't argue. She didn't cry. She just reached for her phone and started texting her boss, her sisters, her mother-in-law. Practical. Efficient. Like she had been preparing for this moment all along. That evening, I administered the first steroid shot. Betamethasone. It helps accelerate fetal lung development. 2 shots, 24 hours apart. If the baby came early, those shots could mean the difference between life and death. The injection was intramuscular. Large needle. Jennifer didn't flinch. She had been getting blood thinner injections for months. A steroid shot in her hip was nothing. But Michael flinched. I saw him look away, his jaw tight. He had been so strong through all of this. The injections, the bed rest, the bleeding, the growth restriction. But watching his wife's body become a battlefield, watching her endure needle after needle, watched her sacrifice herself for a baby who might not survive. It was breaking him too. After the shot, Jennifer lay back on the hospital bed. The fetal monitor was strapped around her belly. The 4-line was in her arm. The blood pressure cuff was set to cycle every 15 minutes. She looked like a woman who had been swallowed by machines. She looked at me and said, "How long can we keep him inside?" I told her the goal was 30 weeks. Every day in the womb was worth 3 days in the NICU. If we could get to 30 weeks, his chances were good. Excellent even. "But what if the placenta fails before then?" she asked. I didn't lie to her. Then we deliver whenever we have to. And we pray that those steroid shots did their job. The second shot came the next day. Then the waiting continued. Jennifer's room became her whole world. 4 walls. A window that faced the parking lot. A television that stayed off because she said she couldn't focus on anything except the sound of the monitor. The nurses loved her. They brought her tea and blankets. They sat with her during the night when Michael went home to sleep. They whispered to me in the hallway. How is she doing this? How is she still sane? I didn't have an answer. Some women just have a different kind of strength. Not the loud kind. Not the kind that announces itself. The quiet kind. The kind that wakes up every morning and chooses to keep going even when every reason to stop is staring them in the face. At 28 weeks, the monitor showed something that made my heart stop. It was 3 in the morning when the nurse paged me. The fetal heart rate tracing had shown late decelerations, drops in the baby's heart rate that occurred after each contraction. It was a classic sign of placental insufficiency. The baby was telling us, in the only language he had, that he was running out of time. I drove to the hospital in the dark. The streets were empty. Streetlights cast orange pools on the wet pavement. My hands were steady on the wheel, but my mind was racing. 28 weeks. The steroid shots had been given 2 weeks ago. The baby's lungs might be mature enough. Might be. There was no way to know for certain without delivering him. When I walked into Jennifer's room, Michael was already there. He must have been called by the nurse. He was sitting on the edge of the bed, one arm around his wife, his other hand resting on her belly. Jennifer was awake. Her face was pale, but her eyes were clear. She didn't ask me what was happening. She already knew. I pulled up a chair and sat facing them. I explained the late decelerations. I explained what they meant, that the placenta was struggling to deliver oxygen, that every contraction put the baby at risk, that waiting any longer could lead to brain damage or stillbirth. Then I laid out the options. Option 1. Continue monitoring. Keep the baby inside as long as possible. Hope that the decelerations were a fluke, that the placenta would hold on a little longer, that we could reach 30 weeks. But every hour we waited was a gamble. Option 2. Deliver now. Emergency C-section. The baby would be premature, very premature. He would need the NICU. He would need breathing support, feeding tubes, probably a long hospital stay. But he would be alive. And we could control his environment instead of leaving him at the mercy of a failing placenta. Jennifer listened without interrupting. When I finished, she turned to Michael. They had that silent conversation again. So much passed between them in those few seconds. Fear, hope, love, desperation. Then Jennifer looked at me, and she said the words that broke everyone in that room. I can't lose him. Not after everything. Not after the 6 before him. Not after the injections and the bed rest and the steroid shots and the months of being afraid to breathe. If there's even a chance that waiting will hurt him, I won't do it. I won't. She paused. Her voice dropped to barely a whisper. Take him out, doctor. Save my son. Michael put his head down on Jennifer's shoulder and wept. The nurse in the corner wiped her eyes. And I sat there for a moment, feeling the weight of what she had just asked me to do. To cut open her belly. To bring her son into the world before he was ready. To take that risk because the alternative was worse. I called the operating room. I called the NICU team. I called the anesthesiologist. Within 30 minutes, the room was buzzing with people in scrubs and masks, preparing for a delivery that none of us had wanted to happen so soon. Jennifer was wheeled into the OR. Michael was given scrubs and told he could sit by her head, behind the drape, where he wouldn't have to see the surgery. He held her hand as the anesthesiologist placed the spinal block. He whispered something in her ear. I couldn't hear what, and she smiled. A small smile. The first real one I had seen in weeks. I stood at the operating table, scalpel in hand, looking down at this woman who had endured so much. Her belly marked with injection sites and stretch marks, now marked with antiseptic. Her body, exhausted but still fighting. I made the first incision. The incision was precise. Layer by layer, I worked through the abdominal wall, then the uterus. The amniotic fluid was stained green meconium. The baby had passed his first stool inside the womb, another sign of distress. Another sign that we had made the right decision. I reached inside and felt for my patient's son. His body was so small, so much smaller than I had imagined, even though I had seen the ultrasound measurements 100 times. My fingers found his shoulders, his head, and I lifted him out into the bright lights of the operating room. He didn't cry. Those first few seconds, I can't describe them to you in a way that does justice to what they felt like. The room was completely silent except for the beeping of the monitors and the murmured voices of the NICU team waiting beside the warmer. Jennifer was saying something, asking something, but I couldn't hear her words. All I could hear was the absence of sound. The absence of that first cry that every mother waits for. The baby was limp. His color was mottled grayish-blue. His breathing was shallow, barely there. I clamped and cut the cord quickly and handed him to the waiting neonatologist, who immediately began resuscitation. 1 second passed. 5 seconds. 10. Jennifer's voice broke through the silence. Why isn't he crying? Please, why isn't my baby crying? I couldn't answer. I was still working on closing the uterus, but my eyes kept drifting to the warmer, where the NICU team was suctioning the baby's airway, rubbing his back, stimulating him to breathe. 15 seconds. The neonatologist placed a mask over the baby's face and began bagging him, forcing air into those tiny, underdeveloped lungs. His chest rose and fell with each squeeze of the bag. But still no sound. Still no cry. 20 seconds. Jennifer was sobbing now. Michael had his forehead pressed against hers, both of them watching the warmer, unable to look away, unable to do anything except wait. 25 seconds. And then a sound. Small. Thin. Reedy. Like a kitten. Like the tiniest protest against the world. But it was a cry. A real, honest, living cry. The sound filled the operating room. The NICU team stepped back slightly, and I saw the baby's arms and legs moving, his color already shifting from gray to pink, his chest rising and falling on its own. 30 seconds. And he was breathing. The neonatologist looked at me across the room and gave a small nod. The nod that meant he would be okay. Not perfect. Not out of danger. But alive. Breathing. Fighting. Jennifer reached out her arms, but the baby wasn't ready for her yet. The NICU team wrapped him in plastic to keep him warm, placed a small hat on his head, and began moving him toward the transport incubator. They would take him to the neonatal intensive care unit, where he would be connected to machines that would breathe for him, feed him, monitor every heartbeat and every breath. But before they wheeled him out, I asked for a moment. I lifted the baby, so light, barely 2 pounds, and carried him to Jennifer's side. He was tangled in wires and tubes already, but his face was visible. His tiny mouth was open. His eyes were closed. Jennifer touched his cheek with one finger. Just once. Just for a second. She said, "I've waited for years to see your face, little one. Don't you dare stop fighting now." The NICU team took him away. Jennifer lay back on the operating table, exhausted, her arms empty, her body stitched and sore, her heart somewhere in a plastic box on the other side of the hospital. I finished closing the incision. My hands were steady, but my eyes were wet behind my surgical mask. 20 years of deliveries, and I still cried at the small ones. The hard ones. The ones that almost didn't make it. When I was done, I went to Jennifer's head and looked down at her. She was half asleep, the medications making her drowsy, her body finally surrendering to the months of exhaustion. I told her, "He's in good hands. And so are you. Rest now. He has a long journey ahead, and he's going to need his mother." She smiled. That small smile again. And then she slept. 73 days. That's how long Jennifer's son lived in the neonatal intensive care unit. 73 days of monitors beeping, alarms sounding, and tiny milestones being celebrated like victories in a war. I visited whenever I could, usually in the early mornings before my clinic started, when the NICU was quiet, and the only sounds were the rhythmic whoosh of ventilators and the soft footsteps of nurses making rounds. I would find Jennifer in her son's pod, sitting in the hard plastic chair beside his incubator, one hand through the porthole, her finger wrapped around his impossibly small fist. She read to him. Board books with bright colors and simple words. She sang to him. Lullabies her own mother had sung to her. She talked to him about the world outside. About the flowers that were blooming in her garden. About the dog that waited at home. About the nursery Michael had finally painted a soft shade of blue. There were setbacks. There always are with micropreemies. An infection that required antibiotics and sent his heart rate soaring. A bout of apnea where he stopped breathing and had to be stimulated back to life. A blood transfusion to replace what his tiny body couldn't yet make on its own. But there were victories too. The day he came off the ventilator and switched to CPAP. The day he moved from CPAP to a nasal cannula. The day he took his first bottle. Just 5 milliliters, but he took it. The day he opened his eyes and looked at his mother's face for the first time. I watched Jennifer transform during those 73 days. The hollow look in her eyes faded. The trembling in her hands stopped. She learned to change his diapers through the incubator portholes. She learned to read his monitors, to know which beeps meant nothing and which ones meant call a nurse. She learned to be his mother in a place where machines did most of the work. Michael came every evening after work. He would hold the baby skin to skin against his bare chest for hours, humming songs, swaying gently in the rocking chair by the window. The nurses told me that he never complained, never asked when they could go home. He just showed up every single day, and loved his son through plastic and wires and oxygen tubing. And then finally the day came. The baby had reached 4 pounds. He was breathing on his own. He was taking all his feeds by bottle. His monitors had been disconnected one by one until only a small pulse oximeter remained on his foot. The neonatologist wrote the discharge order. The nurses decorated his incubator with a sign that said graduation day. There were tears. There were hugs. There were photos taken with every staff member who had cared for him during those long, uncertain weeks. I stood in the doorway of the NICU and watched as Jennifer lifted her son out of the incubator for the first time without any wires attached. He was so much bigger now. Chubby cheeks, open eyes, a tuft of brown hair that stuck up in every direction. He looked at his mother's face and he smiled. A real smile. The kind that crinkles his eyes and makes everyone around him forget all the hard days. Jennifer held him against her chest, skin to skin. Nothing between them except the warmth of her body and the steady rhythm of her heart. She looked across the room and found me standing in the doorway. She didn't say anything. She didn't need to. Her face said everything. Michael came up behind them, wrapping his arms around both of them. The three of them stood there in the middle of the NICU, a family finally whole, finally leaving the place that had been their home for almost 11 weeks. As they walked out the door, Jennifer paused and looked back at me. She said, "Thank you for not giving up on me, for not telling me to stop trying, for believing that this baby wanted to be here." I couldn't speak. I just nodded and watched them walk down the hallway, a small family taking their first steps toward a normal life. You know, after 20 years of delivering babies, I've learned something that no textbook could ever teach me. Patience is not passive. It is not waiting with empty hands and a quiet mouth. Real patience is active. It is choosing to hope when every voice in your head tells you to stop. It is showing up for the 7th pregnancy after 6 losses. It is giving yourself injections every night when you are exhausted and scared. It is sitting by an incubator for 73 days because you refuse to leave your child alone. Jennifer taught me that. She taught me that some women are made of something stronger than fear. And those women, they are the ones who change everything.